All right, let's talk about doulas. Okay, so we have birth doulas, postpartum doulas, night doulas, sibling doulas, even death doulas. Okay, so the birth doula, her focus is on pregnancy, labor, and birth support and everything related to it. Your pregnancy and your labor and postpartum, she's gonna provide emotional reassurance, she's gonna help you with comfort measures, she's gonna advocate and help you advocate for yourself during labor, help you and your partner understand your birthing options, all the interventions that can happen, hospital procedures, and so on and so on. She's gonna help you and teach you comfort techniques like breathing, massage, movement, position changes, visualization. She's gonna help you create a calm environment to help you feel safe and empowered. She's gonna offer prenatal visits to discuss your birth preferences, your pain management, your postpartum plan. And then she will provide the immediate postpartum support. So the first 1 to 2 hours after birth, she's gonna assist you with bonding, with breastfeeding, with newborn care, and a lot of times she's gonna have a postpartum visit as well in your home to help you with anything that you might need at that time. Let's talk about postpartum doulas, okay? So her focus in the very first weeks or months after birth are to support your physical recovery from birth and emotional adjustment to parenthood. She's going to provide breastfeeding or bottle feeding guidance and newborn care tips. A lot of people think they will clean your house as well, but no. But she will help a little bit with light household tasks like meal prep, creating routines, doing some dishes and some cooking if she feels like she will do it. That's kind of like each doula preference. When it comes to that, she will offer emotional support for parents processing their birth experience or adjusting to the new role. She's going to educate you on infant sleep patterns, baby wearing, soothing techniques, and she's gonna actually connect you to other families, local resources like lactation consultants, therapists, pelvic floor physios, anything that you might need. She will have that information for you. What about a sibling doula? We don't talk much about this, right? So her focus is going to be to support the older children during labor and birth. So her role is to provide childcare and emotional reassurance for siblings while parents are in labor. She's gonna prepare the siblings for the new baby, of course, age-appropriate explanations, and she will take care of them while you're in labor. A night doula, so that's like an overnight postpartum doula. Her focus is overnight care for newborns and rest for parents. Her role is to provide nighttime newborn care, so like anything related to feeding, diaper change, soothing, sleep routines. She's gonna support breastfeeding or bottle feeding during the night. So she might bring the baby to the parent for feeds, or she will handle all the bottles and bring the bottles from mom to baby and clean bottles and things like that. All of this is going to allow the parents to get more sleep, especially in those early postpartum phase where parents don't get a lot of sleep. She's going to track the baby's sleep patterns, feeding patterns, and that's going to help the families establish their rhythm for when she's not there.